watching Reality Check. Our focus tonight on India's second wave of the coronavirus, as every data point suggests that the virus is spreading faster and faster. How serious a concern is this? How worried ought to we be? And also now questions looming of a possible second round of lockdowns or similar restrictions across India. Let's just run you through the numbers to give you an idea of where we stand with the virus as the virus spikes, even as India's vaccination drive continues forward. So if you look at the idea of the second wave, all the data points, the spike in 7-day average daily cases is only rising every day. We're registering highest single-day increase in cases since October. On a given day, we're getting close to 60,000 cases just on one day alone. The State Bank of India, amongst those, their research department, forecasting the second wave, they're likely, it says, that we might hit close to 25 lakhs in the second wave, which is expected to go all the way through April, peaking sometime possibly in May. The other worrying indicator, the virus in India is growing faster than anywhere around the world. The reproduction rate, or the R rate of the virus in India, is highest in the world at the moment. This is amongst other major COVID-affected countries as of 23rd March. The R, or the reproduction rate in India, is currently at 1.35, which is higher than Germany, Canada, Italy, Brazil, UK and the US, according to data from Our World in Data. Which are the big states, or who is really contributing to this virus? Again, it's a concentration of states, those spreading to others. We're witnessing recently a big percentage surge of the virus increasing in Uttar Pradesh, Chhattisgarh and Delhi, which by and large where it has started to decline. Maharashtra and Gujarat continue to witness major spikes. Overall, about 5 states are contributing almost 80% of the daily cases. The top 5 states with the highest daily cases at the moment are Maharashtra, Punjab, Karnataka, Chhattisgarh and Kerala. These are the top states at the moment. Now, the only possible piece of good news is that the second wave may be less fatal than the first. This chart is giving you an idea of the fatality rate, that is the percentage of those who are actually dying because of the virus as a proportion of the total number of those infected. And if you look at it, it actually was spiking last year to much higher numbers, but now it seems to have flattened somewhat. Even though the cases are going up, the fatality rate is mercifully remaining under control. Now, all of this is of course happening at a time when India is continuing to vaccinate millions of people, but is that enough? If you look at it as the overall question of the vaccine drive and the target versus the reality, we vaccinated over 4 crore people, which is a lot. But as a percentage of population, India is amongst the lowest in the world. If you look at it in terms of the number of vaccinations per 100 population, Israel is the highest. It's crossed 100, it's at 114, followed by the UAE, by the UK, US, Italy, Germany, Canada, Brazil, China. India, only 4% has been covered so far in terms of doses of vaccination. And one of the reasons is because we're not quite able to meet our own ambitious targets. We're currently vaccinating at the rate of 23 lakh doses a day. To meet our target of 50 crore doses by the month of June or July, that's the target set by the Health Minister, we'll have to up that to about 35 lakh doses a day. As of now, roughly only about 50% of healthcare and frontline workers who were part of the first 2 rounds of vaccinations, only 51% have been fully vaccinated. This even as we've now opened up our vaccination program to a much wider spectrum of population, from those who are now over 45 going to be vaccinated from just about a week from now. Okay, joining me on the show to really look at where we stand at this crucial inflection point with the virus is Dr. Naresh Trehan, Chairman, CII Healthcare Council, Chairman and Managing Director, Medanta, the Medicity, Dr. Ram Vishwakarma, Advisor of CSIR, Chairman of the COVID Strategy Group of CSIR, Dr. Niranjan Harinandani, President of the NAREDCO, which is the National Real Estate Developers Association, and also past President of ASSOCHAM. And with us is Dr. Rachna Kucheria, who's physician and founder, DocGenie Telemedicine, and is an epidemiologist and also is working on the ground. Thank you all so much for joining us. Let me just start with you, Dr. Vishwakarma. How worried are you when you look at the numbers which are indicating this second wave?
Yes, so Srinivasan, I consider this as an inflection point for the battle against coronavirus. And I think this is very serious, and number is one side, but the opportunities that are being provided to virus to mutate. And I think we are looking at a much bigger serious problem if we are not really able to contain this at this stage, because what is happening elsewhere and the kind of double mutants, insertion mutants, deletion mutants, and actually there is a likelihood that in absence of sufficient T-cell backup, many of these vaccines that we are banking on may lose efficacy. And I think there is a far greater need to be vigilant and vaccinate people as fast as possible. But after all this, I think the COVID preventive measures are the real vaccine, according to me, scientifically. Right. So I think those measures, we are lowering our guard. I think we will have a major problem in our hand.
Okay, what you're saying sounds worrying. You're saying that this is even more worrying than the first round because, correct me if I'm wrong, what you're saying is that the virus is mutating and that the vaccines that we have currently may not necessarily be able to combat these mutations. But I think the last point you make is very important, that our guard is lowered and there are too many of these opportunities for the virus to spread. Before I move on very quickly, could this second wave have been avoided, or is it something that is inevitable, or could we have avoided it?
No, I don't think you can avoid it because of the size of the population. And I think we have done pretty well globally compared to other countries. We have done, I think, thanks to a large number of people, multitude of the people, a very decent level of discipline has been maintained so far. And I think this is the virus evolution cycle, so the virus will keep on evolving. I think that is where we have to adopt a strategy, and particularly when there are large number of one dose vaccinated people. That also, in fact, yesterday a major study has been published in the United States, which are now indicating that actually the one dose vaccinated people are contributing to more virulent strain development, which is now, which is very surprising. And I think we have to be very, very careful. And the COVID containing measures to me are the real measure, other than of course vaccination that is panning out.
Right. Dr. Trehan, are you also equally worried, and also is this inevitable that we're in the middle of the second round, or could this have been checked?
So I've been worried for a couple of weeks. As we saw the numbers going up, we always said the second wave is coming. There is something that we need to do immediately. And the three things that we need to do, as Dr. Vishwakarma said also, is the fact that the first defense is only COVID appropriate behavior. That means that responsibility lies on the population. They must realize that the virus has not gone away. Now that's the false feeling people got, that as the numbers were declining, that, you can let down your guard, people are having much bigger weddings, gatherings, and then you see all these visuals of Kumbh and now Holi coming up. So these are events which are super spreaders. So that is one thing, appropriate behavior by the public and the enforcement and advice from the government and all of us professionals on a daily basis. And what you guys are doing is a remarkable job, that you are at it day and night, which I think is the only hope we have to get the first defense.
Right.
The second defense is the fact that the vaccine is there. No matter what you say about the vaccine, it'll help, no question. So we need to vaccinate as many people as fast as possible, what is earthly possible, because there are some confusion about how many doses are available, but from my last understanding was that 7 crore dosages per month are already available. And if Sputnik vaccine gets approves the next week or two,
Right.
then we will have maybe 1 or 2 crore more. So with that, that means that we need to get to our target of 35 lakhs as ASAP. Okay, that's one part. So the third part is that we should not take comfort from the fact that yes, the numbers are rising, but the fatality is less. Now, you never know which direction it will go. As you know,
You're right.
the virus keeps mutating. The next one may be much more dangerous than we are experiencing today.
Yeah.
So come back full circle to the same point. Government is doing what it's doing. The scientists are doing what they are doing. But
We
is
need
the
to keep
public
our guard
doing
up.
what we need to do? No, that's it. No, but we must help them. We must help them in the sense.
course, but
go back to weddings being less than 50 people. Go back to
Now, this is-
restrictions
No,
without
you're right.
without locking down.
You're right. There is a contradiction here, though, because on one hand, you have the government rightly expressing caution and advising everybody, people, states, that you must control crowds. On the other hand, we're in the middle of a massive election, and the same leaders, center, state, oppositions, everyone's out there holding huge rallies, and you see these visuals. Many people are not wearing masks. You have huge religious festivals going on. There doesn't appear to be any serious attempt to contain it. So you are getting conflicting signals right from the top. That's part of the problem. But I want to ask you about the lockdown point you mentioned, and I want to take that to Niranjan Hiranandani, because Mr. Hiranandani, now a number of chief ministers are saying we don't want to go in for a full lockdown, but particularly Maharashtra, where Mumbai, where you are, which is turning out to be really once again one of the hotspots, the government is saying, look, if it's not going to be contained, we may have to go in for fresh lockdowns. Do you think that's a good idea? Or would that be a problem?
I think I don't think anybody would consider a lockdown, a total lockdown, as a good idea, for sure. But it would be only a very desperate measure that we may have to do it, and I do hope that it doesn't happen. Because economically, the negative is so bad, and the poverty to the poorest of poor is still hurting the people. So it's not easy to recover from that. So the kind of hurt which is taking place would be tremendous. I do hope that we don't have to do it. But of course, ultimately, if the doctors who are there on the panel and also the government health side decides to do so, I think it will be a terrible time for the economy, for the poorest of the poor people. Number two,
But
I
Mr.
do think that
Hiranandani,
it's an advantage that we have now with the experience. So for example, the construction workers that went back are now all back, and we are taking care of them, sanitizing them, looking after their food, their healthiness, their vaccination. All that is being done. So I think they have been taken care better here than they were back home in West Bengal or UP or wherever. So I think this time, at least the workers are not likely to go back as it happened in the last time, if we are careful to permit them to continue to work at least on site.
right. No, that's fair enough, because I was about to say that while you're right to say that another lockdown will hurt the economy, but if workspaces and work sites, you start getting infections, then perforce one will have to start closing those down. So, how do you manage that? But like you're saying, at least in some instances, if employers are being cautious and are taking precautions and are vaccinating workers and testing workers, that's good. But Dr. Rachna Kocheriya, in the wider ambit, are you seeing on the ground the impact of the second wave? Are we seeing once again the load on India's medical infrastructure, especially outside the cities?
I think we are. I think it's going up. I'm already hearing from patients that beds are becoming difficult. And I'd like to make 2 points on some of the discussion prior. One point about the fatality, although we are seeing less case fatality this time around in this, 21, this spike. But remember that the virus is spreading much faster. So as an example, from March 15th to about now, not even the end of March, we've seen a 3-time rise in cases. So what's going on? Of course, there's pandemic fatigue and some of the events you talked about, mass public, all of that. But we cannot rule out variants. We can't rule them in, we can't rule them out also. Remember the example of UK. This is exactly how it restarted for them, and then they figured out that there was a variant. So that might be happening. We don't have enough data to refute or accept it, but that's one thing. The other, I do want to point out, perhaps some strategies could be sort of focused. People who have the luxury, offices, large corporations who have the luxury of letting people work from home, do that, so that the ones who don't have to forego their daily wages. So that's something I think people can do. A lot of people that I'm seeing, and of course I practice in urban Delhi, are coming from offices, or they've shared transport. And the second part I'd like to say is, as we're opening up vaccine, perhaps another strategy that the government could look at is the 5 states you spoke about, Maharashtra, for example, or Punjab, where you're seeing, massive rises every day. Bring the vaccination age down lower, focused, vaccinate all of them there. Because what's in Maharashtra will reach other corners of the country, just like what was in Wuhan reached the entire world.
Exactly.
So why wait for that? Focus, don't spread it like confetti perhaps. I do understand there are supply issues, but focus on the states where you're already seeing trends for the past, 6 to 8 weeks.
Right. Dr. Vishwakarma, you were talking about just sticking to the basics. You said even more than vaccination, just follow the basic COVID safety protocols. But when you see that not really happening, this whole question of a lockdown, is it something that you believe might become necessary at some point? Perhaps you could even share with us whether that's something that the government is even talking about or is mulling internally?
No, I think lockdown is not the solution. Lockdown actually, I look at differently, counterintuitively, may create bigger problem. Both virus point of view, both economy, of course, is the one issue. So lockdown is not the solution.
Okay.
Solution is, I think, more emphasis on informing people, creating measures so that, economic activity continues. At the same time, people follow. I think majority of people are aware. I think last 4 or 5 months, there was this impression went around that, we are somehow different and we got out of it. This impression was created that we are not part of the global sort of pandemic, and it is converting into endemic. This argument was going around. I think Dr. Trehan will vouch for this, and I think that was not a correct argument. We are still in pandemic, and I am really worried about scientifically that what is really results that are coming out, which that we have to actually very quickly start clinical trials on pediatric population, because India is a young country. Even if you so-called vaccinate all people, that population is missing from vaccination, and that population is the one which is the largest spreader, asymptomatic spreader. Nothing happens to them, but they spread to large number of population. I think larger trials are required. Yeah.
Pediatric?
Children.
Yes.
Pediatric people. I mean, these trials must happen faster in India. They are not happening. And I think the second thing is that I think overtly larger emphasis worldwide had gone to only one protein of the virus, all vaccine converging on spike 1 protein, and all the mutations that are happening in that protein. And we have now basically almost 70 to 60%, some of the mutants are not just caring about that particular antibody that is being generated by this. So I think there is a need to go back to drawing board and work with industry and a medical institution, scientific institution to have next generation of vaccines. So this is not the end. I can tell you upfront that we have to look at alternative vaccines and therapeutics, and of course some of the measures which are required in terms of and fortunately 1 year down the line, we are much better prepared therapeutically of course vaccines are there, but therapeutically we are much better prepared. So I think India should sort of encourage more such studies, and I think we will be then complement with vaccines, because track record of RNA-based vaccine, to tell you honestly, is not very good in last 50, 60 years.
Wow. I mean, alternate vaccines, we're still struggling to make sure that the existing vaccines get fully covered. And as I think someone was saying, there are also questions over supply. We don't know exactly whether the vaccine makers are able to produce at scale. There are questions also over whether they've stalled exports for now. So there's a little bit of a gray area there over where we stand with the vaccine. But very quickly, Dr. Trehan, as we start to wind down, are you seeing at the moment in your own set of hospitals any indication of this spike, any growing pressure, or fingers crossed, nothing like that yet?
No. The pressure is on, no question.
Okay.
I mean, we have had a surge. Fortunately, we are very well prepared, and with the therapeutics and with our understanding of the whole syndrome, we've been able to produce very good survival results. But doesn't mean people are not suffering. And you should see the survivors who are also, long term, they're still getting a lot of symptoms. It's a very debilitating problem. So I don't think that we should take it lightly in any way or form. And like I said, it's a three-pronged attack. We must maintain all three things as far, consistently, as fast as possible.
Right.
So it comes back to test, trace, and treat.
Right.
Isolate or lock down hotspots immediately. Whatever we can do. So this is all additive. And then, of course, vaccination, behavior, and regulation, which will prevent all this night partying and big bar, people going to bars and just kids throwing everything to the wind. I don't think that that's to be encouraged. In fact, we should come down rather than lockdown. I'm not in favor of lockdown. That's going to be very, very devastating for our country.
Right.
We should all play our role seriously, responsibly.
Right.
Vaccinate, vaccinate, vaccinate.
Mr. Hinandani, the government has now started, as I said, to expand, more the vaccination ambit, but there are still caps. Would you agree with what Dr. Kucheria suggested, that in particularly states like Maharashtra and so on, just make it open for everybody?
I agree with him 100%. If you must now vaccinate completely the entire population, especially in states like Maharashtra, we should open it out, open 24/7 vaccination centers. It should be available round the clock for people who would like to come. Completely open, no requirements, registration maybe, but not to have any age restrictions above 18, above 21, whatever Dr. Trehan or Dr. Vishwakarma suggests, but it should just go across the board, because anything less than that is going to be disaster.
Okay, less than that will be disaster. Last word from you, Dr. Kucheria. Do you see anything at all which is positive about all this at the moment? Any signs that people are starting to, this government, everyone's starting to come under a little bit of a caution, or it doesn't seem like that right now?
I do think that there's caution, and I'll put a wish thing out here since everybody's talking about the future. Remember, we've been barraging people with messages, and of course we've seen these rallies and all of that, which also befuddles me completely. How can leaders not send out the correct message? If you're having a rally, at least have the masks. But I'd like to see personally more science on the transmission. There is COVID pandemic fatigue. Let us accept it. We all also have it. Let's be honest about it.
Sure.
So let's get out the second layer of advice as well, that, if you're meeting outdoors, what does that mean? How much safer is it? What kinds of activities can you do a little safely, so that you ease some of now the mental health issues that are being seen? Human beings are going to meet. So let's accept that.
Okay.
And how can you do it a little more safely? That's where I'd like to.
Okay. Well, let's see how it pans out. Thank you all so much for joining us on the show. You've been a great panel. Thank you so much for watching Reality Check. Goodbye.